All right, yo, what's up, everybody? So today I'm gonna go into the hip update at 3 months. It's also the shoulder update for 7 months, and the knee at a year and 2 months. There's been quite a bit of like constant setback on the healing journey to get back to breaking, but I'm just gonna go review over some breaking clips. Around the 3 month mark, I was getting a lot better, surprisingly. Um, the first practice I went to, I just practiced baby freeze on both sides. Um, I actually haven't been practicing this recently, so I actually feel like I baby freeze better on my left arm back here. But I've been just taking a break because I've been having some shoulder pain in the right side now. And then I'm doing like handstand circles, and I'm really easing back into everything. I'm doing back spins just to see like how much my hip can move, because that's like the main limiting factor. The labrum is healed, like slash reattached at 3 months, but I, don't know anyone who's ever gone through this operation, so I'm just really careful. I don't want to like injure anything again. And then you'll notice that when I'm doing the forearm stand, I'm not doing it with wide legs, and I'm doing it leaning towards my right side for my right shoulder and then back to my left, but I'm not really comfortable being in this position. You can see it's just wobbly. I mean, the shoulder can take the load, but it wasn't as strong back then. And then, yeah, so same here, just another clip of me doing the elbow freeze and then probably transferring back over. And just gracefully falling out. And then my tried and true of seeing how I'm doing is I was doing baby mills and then I was going into head spin. And then I felt pretty confident about that, so I started from standing and just decided to eat it. My physical therapist was not super happy when he saw that clip on Instagram, but I was super happy. And let's see. Yeah, just more baby mills, more baby mills. And I actually did a shoulder spin. So that was my first shoulder spin on my left shoulder since surgery. And then I was just feeling so confident. I was like, you know what, I bet I could like 2002, and I could. So as long as you have the technique pretty good, like I wouldn't worry about losing that
What's
stuff.
up, everybody?
Okay, so basically, if you have like your technique pretty good, I wouldn't worry about like losing it. If you're recovering from surgery, just stick to protocol. But next, I'm gonna go into some stuff I recorded back in the past, because I'm recording this and trying to gather my thoughts around what I was thinking back then. But I actually recorded like what I was doing at the time in PT and what I was going through. So we're gonna go to that now. Yo, what's up, everybody? I just finished my second practice since my hip surgery, and it was pretty dope. I did banded walkouts on my shoulders, so I'm focusing on like my shoulder blade engagement. I'm focusing on keeping my serratus and my scapula in motion, and I also worked on the banded hip march, so that's trying to get like deeper hip flexion. And one thing I'll know is I try to tilt my hips so I can engage my core better and engage my hip flexors. And the basis of that is by tilting your hips, it should also make more room in your hip capsule. So my physical therapist said that it should increase the longevity of my hips. It's a little concerning to hear that, but I'm sure one day I'll need a hip replacement, unless I die before that. Anyways, then I also did the downward dog to cobra stretch to warm up. That's pretty dope because before I couldn't feel this like tightness or engagement in my left shoulder because the labrum was torn. And also my hip, it never felt really good when I did downward dog. The hip area just always felt tight no matter what. And I did this downward dog to shoulder taps, and I'll kind of demonstrate that with a band because I do that assisted with a band at PT. And it's really good for engaging your mid-trap muscles for handstands. And then do some push-ups, forearm balancing, so kind of doing my forearm freezes and trying to push through my shoulder blades and then adjust onto my right arm and my left arm. So I want to get that really solid before I start doing like elbow tracks again. I did my handstand circles, but I did that with closed legs because I can't keep my legs wide right now. I'm still only 3 months past my surgery date, and then did baby freeze both sides. That's starting to feel pretty good. I want my left side still a little more strong, a little more stable. I tried a chair freeze on my right side, and my back started cramping, so I think I gotta ease into it a little more. And then did some back spins and some baby mills. I feel like baby mills are like my go-to move. That's my bread and butter of like never losing it. I also did do a 2000, but I didn't record it, and I don't want to record it because, yeah, I just feel like I'm gonna hurt myself if I keep doing it. All right, now to the updates. I got my ACL update, so it's been a year and 2 months basically, and at this point it's pretty good. You know, the flexion is good. Like I can basically do everything. I can kind of top rock. It like, honestly, even hiking feels pretty good. The thing is, if I like go to a breaking practice and I top rock a little bit and just kind of play around with my knee, it gets kind of sore still. So I think it's still getting stronger. And a main focus right now is I'm doing step ups. So I'm doing these step ups basically like if I had like a bigger box, this would be an easier example. But what I do is I'm trying to get my like single leg strength back because I used to be able to pistol squat like all the way down here and back up, but I'm having a lot of trouble in this bottom range of motion. So what I'll do is I'm going to grab onto this for safety right now because I'm not warmed up or anything, but I'll just step up and then I'll go down, and sometimes I'll have like a higher box, so it lets me get a little focus on this end range when I'm going up, and I'm trying to engage my glute when I'm doing this. So that's my current focus on the knee, but other than that, it's good, and I'm trying to incorporate single leg extensions or single leg press at the gym, the machine that people love to load up with like, you know, 1,500 pounds and then do that. But I'm trying to just do single leg and get this real good again. All right, next is the shoulder. So the shoulder, it's been 30 weeks now. So that's basically about 7 months. My whiteboard says 22 to go because I'm trying to like not really do too much crazy shit until like the 1 year mark for my shoulder. But at PT, basically, they have me do this like assisted workout. So I get like a heavy support band, and then I wear another band around me. And basically with this on, I'll like go down, and I don't know if I'm gonna be in frame, but with this, it kind of like supports me when I do push-ups. I can kind of do these on support. Oh my God. I need a new band, but I'm gonna edit this out. Well, I'll keep that in, but I'm gonna have to switch. All right, I'm back with a purple band, and hopefully this one does not snap, but that's not very reassuring because when I watch my footage, I feel really like big and thick. Like I was 200 pounds at my first practice. Now I'm like 194 because I'm starting to diet and lose weight. I'm trying to dial in. But yeah, this band snapping is not reassuring for me. But basically, I'll have this band on, and I'll do push-ups. So this supports me, doesn't put too much load through my shoulder. I can really focus on pushing through my shoulder blades, engaging my serratus, and then from here I'll go down, make sure my shoulder blades are engaging, and then up. Now, the exercise I learned at PT that's really good today is, so my physical therapist isn't too happy with me doing handstands, but he knows I'm gonna do it anyways. So he gave me some other workouts. So this one workout I really like, actually. Basically, when you're doing a handstand, you go into this downward dog position, and I hope this isn't too close to the mic, but when you're in this position, you try to lock out, try to really feel it like in your mid back, and then you push out. Make sure you're pushing like down and up like a handstand, and then you can spread your legs wider if you're having trouble balancing, and then you'll just hold this position and alternate. And go for like one set of 10. And this is pretty dope because I really feel it on the left side in my mid-trap and back, like in this area over here. And I think it's really hard to get that spot sometimes. So I think this is a pretty good exercise for people to do. And you don't need any equipment besides like 2 bands. You can just find a pull-up bar somewhere or rig something up. I don't know, but or you could just do like one of these bands around like those dip bars at the calisthenics place. But yeah, I mean, I would definitely recommend this exercise for a try, especially if your handstands suck and you can't at 2,000. But yeah, other than that, like my shoulder feels pretty good. Like I'm doing freezes again. I think it's just gonna take a little more time, so I'm gonna be patient because you know, I messaged this Olympian or junior Olympian guy on Instagram a while back. He said it took him about a year to get back to like 90% strength, and now his shoulder a year and a half out is better than it was before his injury. So, you know, it's very promising. I feel like this is really just a patience game and like getting your strength up. I'm trying to like go for longevity and how long I can keep breaking. And then, yeah, last but not least, the hip. So it's been 3 months, you know, I'm starting to like do these workouts at PT where I'm kind of like doing this like lunge and then like dragging a weight over. So I'm starting to like strengthen my adductors. I'm at the gym. I'm doing the open close leg machine. I'm doing hamstring curl. I'm doing hip thrust. I did a 145-pound hip thrust the other day for like 12 reps. Then I did like a 135-pound deadlift for 12 reps. I want to get back to like my pre-injury strength numbers. So that was like 315 by 5 deadlift and then like 275 by 5 squat. I think I could have gone, my 1 reps are higher, but I don't know if I really want to push it that far again because I just want to get to like my baseline level of strength again before I start breaking. And regarding the hip, I was doing the squat assessment. So basically the squat assessment is like, there's like the force load plate I described before, and you do a squat with your hands on the hips, and then as you go down, you push up. And this kind of tells you like if you're using one hip more than the other. It's kind of like telling you if you have to work on your imbalances. And this time I did the normal squat. I did the jump squat like this, and then I also did a squat where you kind of just use your momentum and go up and down. And then I also did single leg jumps. So I did the right leg going up like this and landing, and then the left leg going like that and landing. And passed all the tests, so I'm clear to start working towards jogging, running, jumping. But you know, I don't really run, so maybe I'll just like cycle, hike, and try to ease back into braking. I'm still not doing footwork. I'm trying to really take it easy, not do windmills until like the 6-month mark. So I think like May 2024 is when I'm gonna really start working on this regimen I planned out, and I'll document that also later. But that's my only update for my hip, and I'm not gonna give another update till my 4-month mark, so that's gonna be my next operation visit. And then after that, I think May, June, I'm gonna try to get an assessment for my shoulder and my hip, get cleared, and then I'm gonna document, you know, how long it takes me to relearn moves, what it feels like, and, you know, just document like everything I learned along this journey. All right, peace.